Good day, friends of Buzzy. Who is in the mood to vote? I know I am. But they don't have early voting in Georgia until October 12th, which gives me plenty of time to get ready. And I'm going to tell you today the 5 things that you can do to make voting in person the safest. All of these things have relationships to coronavirus data that has been published, that has been supported by Dr. Fauci, or that has ongoing clinical trials that are evidence-based. 5 things. You can be so safe. So first of all, let's just say it's probably best if you can vote in person early. Early voting tends to be a lot less congregated. There are fewer people who are there at one time, and the lines go faster. What we know about coronavirus is that it enters through aerosol particles, at least in large part. And this means that the longer you're in a closed room with lots of people breathing, the more risk there is. So if you vote early, then you've got fewer people in the room, lines move faster, less time in an enclosed space, safer. That's not even one of my 5. All right. So 2 weeks before you go vote in person, get your flu shot. The reason to get a flu shot about 2 weeks early is because the immune response that protects you from flu doesn't really get rolling until about 2 weeks. While we don't know for sure that the flu virus protects you against coronavirus, there have now been 3 studies that have shown that people who got the flu vaccine were actually less likely to have severe coronavirus or less likely to catch coronavirus. We're certainly seeing with things like the BCG vaccine, which is the tuberculosis vaccine, that countries that routinely give this vaccine have lower COVID rates. So therefore, getting your flu vaccine in time for there to be any direct protective immunologic readiness means you need to get it about 2 weeks in advance. If you don't like getting a flu shot, take a Buzzy, use the vibration and ice for about 30 seconds, slide it up, get the flu shot 2 weeks in advance. Now, 1 week in advance, you need to be working on your immune system. There are about 5 things that have been proven specifically with coronavirus to help your immunity. There is a treatment that's going around called ICAM, and the I of ICAM is something that happens before you have to go in the hospital, which is immunosupport. Now, in the protocols they're using in hospitals, it's vitamin C and zinc. But one other support for your immune system is vitamin D. If your vitamin D level is fine, it's not going to help. But most people's vitamin D levels aren't fine. And as the days get shorter, they're going to get less fine. So there's no reason not to start taking vitamin D a week before you're ready to go vote. So we've got zinc, vitamin C, vitamin D, exercise. Exercise, and people that exercise twice a week were actually found to have lower risks of catching coronavirus. Was it because of the exercise, or was it because they tended to be leaner people? And we know that obesity is correlated with coronavirus and severity. Don't know. But there is at least a good body of literature showing that after exercising, you are more resistant to certain viruses. There's no reason why coronavirus should be any different. So get some exercise. Don't drink alcohol. Alcohol not only makes you more susceptible to specifically coronavirus, but also other viruses. And finally, after you've got all of your vitamins on board and your exercise and you've got your zinc and everything else, if you want to, you can take some quercetin to help the zinc get intracellular. That one has been used in protocols, has some support in retrospective studies with coronavirus, but not as strong as the others at this point. All right, now, day before you vote, we're T-minus 1 day, get a COVID test. Right now, in many places in the country, the availability of tests is high and the waiting lines are short. So if you have a negative COVID test the day before, or 2 days, if that's how long it's taking for test results in your community, you know you're not risking getting anybody else sick. So help other people, help yourself. COVID 1 or 2 days before, see about getting testing. Now, when you are actually going to vote, the day of voting. All right, this is obvious. Do the mask thing, right? So keep the mask and keep it over your nose, because as we have mentioned many times, the COVID that you're going to be worried about getting inside a testing center is definitely going to be aerosol. It's going to be respiratory. It's going to be people coughing. It's going straight up your nose. So wear a mask to protect yourself from getting a huge viral load. The inoculation reduction can be even better if you wear a nose clip, because you look like a dork and maybe you sound really nasally, but if you're wearing a mask, nobody can tell. And it doesn't matter how many hours you're in that room, you're not going to be inhaling any particles, whether a cough or an aerosolized respiratory particle, if you have something blocking your nose. I will tell you, from having worn this thing for grocery shopping and in small rooms and situations where I don't feel comfortable, you will get a little bit of nasal drip that normally you would swallow, and instead it's going to come out. And it does change your talking and your sound of your voice. So you may want to practice with it and get used to it, but get a metal one so you can bend it so it's really comfortable and not pushing too much. The only thing you need is to just not be able to breathe in with your nose. And it's almost enough of a suggestion when you have it on to remember, try to breathe with your mouth, because it takes about a week before the receptors in the mouth and lungs can receive the SARS-CoV-2 virus, whereas the ones in the nose are good to go right off the bat. So this guy. Now, the other part about the nose is after you leave, say somebody coughed in your face, say they didn't have windows open, say that there was a really long line and it was a very small old room. That's when I would turn to the irrigation and nasal treatments that are being tested right now. So there are about 14 randomized controlled trials. Some of them are using nasal sprays with betadine. Some of them are using nitric oxide. None that I know of are using alcohol, but there are some that are just straight using nasal sprays. And some of the spray studies are already showing positive results in terms of decreasing the viral load or in terms of being protective. So we don't have the final results on these. They're not even in the medRxiv preprints yet, but the logic is strong. It makes sense. And so if I were to go and vote early and I felt like somebody coughed on me or I forgot my nasal clip, I'm totally going home and doing Navage nasal irrigation. You can get a much less expensive one with the NeilMed nasal irrigation, but these are definitely things that after you've been exposed are probably mitigating in the same way that having a mask mitigates the inoculation, the amount of virus that you get, and makes you less likely to get sick. So the sum total of all of these things is that you want to get prepared as much as you can with your immune system in the 2 weeks before. You want to get your flu shot, get your vitamins and your sleep and your exercise up to date. Try to stay in the room as little as possible by voting early, and then wear something that completely keeps you from getting anything up the nose, and rinse your nose out well if you unfortunately did happen to get something on there while you're sitting. So please like us, subscribe. There's information about how to get a Buzzy and what to do if you have needle phobia on buzzyhelps.com. And we will be here again next week to bring you the latest and greatest in coronavirus information, preprints, likely things that work, and ways to keep yourself and your family safe. Home stretch, guys. It's going to be fine. Vote early.